Okay, let's do epinephrine. Or epi. Goes by both. So it is a sympathetic agonist. I don't know why I had trouble with that. Sympathetic agonist. It potentiates the sympathetic nervous system. And it does this through alpha and beta adrenergic agonists. It works with both the alpha and the beta adrenergic receptors. Okay, so what does alpha and beta mean? So the alpha effects of epinephrine are smooth, cardiac muscle, vasoconstrictor. So it is going to pull blood in. It is going to vasoconstrict and pull blood to the core, feeding the heart. Beta effects are going to act on the airway muscles, and it's going to cause them to relax. Musculature, causing it to relax. So what does that mean? That means that the airways are going to open. They're not going to be constricted, they're going to be relaxed. They're going to open up and it's going to breathe easier and it's going to help oxygenate the blood. So that's a good thing, right? So we are increasing blood return to the heart, as well as increasing oxygenation through relaxation of the airways. So it's a great drug, right? Works very well for that. Okay. So what are our indications for this? Well, cardiac events, such as cardiac arrest, sympathetic bradycardia, just going to abbreviate it to Brady, sympathetic Brady, normovolemic hypotension. Normovolemic hypotension. What does that mean? It means they are not bleeding anywhere. They have not lost fluid. They're not dehydrated. They are normovolemic. They have the normal amount of hydration. They have the normal amount of blood that they should have, but they're low on blood pressure. Okay? Allergies, anaphylaxis. anaphylaxis, anaphylactic shock, and severe bronchospasm. Okay, pretty clear, right? Contraindications. I don't know that there are any contraindications to epinephrine in the emergency setting. Okay? So we'll just do that. They can't say that they are allergic to epinephrine because it is naturally occurring within the body. What are our dosages? Okay? So for cardiac arrest, you're going to give 1 milligram of 1 to 10,000 IV push every 3 to 5 minutes. I think I'm going too far off the thing again, aren't I? IV push every 3 to 5 minutes until return of spontaneous circulation or ROSC. Asthma or bronchospasm. You're going to give 0.1 milligrams per kilogram. 0.01, correction, 0.01 milligrams per kilogram of 1 to 1,000 IM. Okay? A max single dose of 0.5 milligrams. That is for asthma as well as anaphylaxis. Okay, so let me hit that again real quick. So for cardiac arrest, 1 milligram, 1 to 10,000 IV push every 3 to 5 minutes until ROSC. Asthma or anaphylaxis, you're going to give 0.01 milligrams per kilogram of 1 to 1,000 to a max single dose of 0.5 milligrams of half a milligram of 1 to 1,000 IM. This can be given IV, IO, IM, sub-Q, used to be given down the tube. We no longer give it by ET tube. And you can also give it inhaled. And that would be racemic epi, and we will discuss that later. Adverse effects, well, you're getting their heart going, so you're going to have palpitations. You're going to have anxiety, tremulousness, tremors, headache, dizziness, hypertension, and if they are in having an ischemic event or are compromised, this could possibly worsen cardiac ischemia. Okay. There are two preparations available, as we discussed. There's 1 to 10,000 and 1 to 1,000. Just depends on what you need at the time, which one you grab.